Hey guys, welcome back to my channel. So in today's discussion we will be talking about the atrial flutter and the fibrillation, and we'll try to differentiate between these two, right? So during our clinical practice, very commonly we can see the atrial flutter or the atrial fibrillation. They are not very rare in the patient right? So if you are working in the casualty or in the ICU, right, so usually at these places you might find some ECGs, right, either on the monitor, either on the ECG paper, that might be showing the atrial flutter or fibrillation, right? So how to identify them, that will be the criteria for this video. So over here guys, you can see some of the ECGs, right, flashing on your screen right now. So firstly I'm starting with the atrial fibrillation guys. Okay, so let me start with the atrial fibrillation over here. Atrial fibrillation, if you talk about, right, what are the important criterias, right, on the basis of which we can comment upon that yes, this is the atrial fibrillation or this might be the atrial fibrillation, right? So guys, some points I'm going to highlight over here. Firstly, that if some patient ECG you are seeing and you are seeing that there is a narrow QRS complex, right? So narrow QRS complex, first of all, narrow QRS complex is a good thing. It's a normal sinus rhythm criteria. Secondly, if the patient is showing the tachycardia, so any ECG which is showing the heart rate of more than 100 beats per minute, right, that will be considered as tachycardia, and we have already discussed that how to calculate the heart rate through an ECG, right? Third one is that tachycardia, it means heart rate is more than 100 beats per minute, right, obviously. Okay, now guys, what about the rhythm? Rhythm over here, very important point, that here the rhythm is irregular. So you will be seeing that irregular RR intervals will be seen on the ECG paper, right? And if you are seeing sorry, and if you are seeing the irregular RR interval on the ECG paper, it in most of the cases it is the atrial fibrillation until proven otherwise, right? So what I said is that if the patient ECG is showing the narrow QRS complex, right, and having the tachycardia, at the same time the rhythm is not regular, the rhythm is irregular, RR intervals on the ECG paper, you are seeing that they are irregular, you will be checking on to the pulse of the patient and you will be feeling that yes, the patient is not having the regular pulse. So always check on the check on the pulse of the patient as well. Just tap your fingers on the radial artery, feel it for some time, feel it for 15-30 seconds, and you will be knowing that yes, this patient is having the either regular or irregular rhythm. So for an example, you are analyzing some patient and you are seeing that on the monitor you are seeing the rhythm as such is not regular, right? So you can check on the pulse. Usually we are checking on to the radial artery, so you can check the pulse and you will be easily knowing that whether this patient is having the regular or the irregular pulse. So in case if you are finding that yes, the pulse which I am feeling right now, this is irregular, so probably this patient is having the atrial fibrillation, right? So in most of the cases, the patients who are having the irregular RR interval or irregular rhythm, mostly they are having the they are actually having the atrial fibrillation. Having that, they are having the tachycardia as well. So in most of the cases they are having the tachycardia. You will be seeing the monitor heart rate will be fluctuating like anything. Okay, right. So these are the important 3 points which can actually trigger your mind to think about the atrial fibrillation. For example, you are seeing this ECG, right, and in this ECG, right, what I am seeing for an example, however this is not enough that you can comment upon that this is atrial fibrillation, but still if you will be seeing that this will be the here this is the QRS, this is also the QRS, but between the QRS you can't find out basically what is happening. Basically these are the fibrillatory waves, right, which you are seeing right now. These are the fibrillatory waves, so I can't comment upon that whether they are P wave or T wave in between. So these are the fibrillatory waves, and between these two QRS complexes there are 4 fibrillatory waves which I can see over here, and in between this one and this one only 3 fibrillatory waves I can see over here. So rhythm is not regular obviously over here, so I can say that yes, this patient might be having the atrial fibrillation, right? let's move on to the other ECG as well, guys. If you will be seeing this ECG, right now I'm just focusing on to the atrial fibrillation only. Maybe this patient might be having other diagnoses as well, but for now the purpose is to find out that this patient is having atrial fibrillation or something else, right? So over here what I can see is in this ECG, right, a very narrow QRS complex. Yes, this patient is having the narrow QRS complex, as you can see over here. I am looking over the second ECG, second lead over here, that is the rhythm lead, right? So that is the thing over here. And if I will be seeing the RR interval, right, so RR interval, for example, over here there are two bigger boxes, but over here they are more than two bigger boxes, right? Here also slightly more than two bigger boxes, slightly more than two bigger boxes. Here might be two bigger boxes only, right? So this is the case. For example, over here more than two, over here more than two, or right? So that is the thing. In between the RR interval, what I can see is the here what I can see is these are the fibrillatory waves, right? So these are the fibrillatory waves over here. Okay, so this patient might be having the atrial fibrillation, right? So once again, guys, you have to look upon the second lead, right? That is the rhythm lead. Okay, once again, guys, look at this ECG. We will be seeing the second lead. So over here, this is the second lead, right? So usually below the ECG paper, the last lead which they are showing, usually this is the rhythm lead, that is the second lead, right? And in most of the cases we are looking at the second lead over there. So over here also what I am seeing over here is that look at the R wave. So this is the RR, I mean the QRS complex. This is also the QRS, right? So if you will be seeing the QRS, right, over here, then what I can see is, look at the RR interval, right? So look at the RR interval over here. So 1 2 3 and approximately 4 boxes are there. 1 2 3, approximately 4 boxes are there. 1 2 3 4, more than 4 boxes. 1 2 3 4, more than 4 boxes. 1 2 3 4, almost 5 boxes, right? So here also I can see that RR interval is not regular, and in between that you can see fibrillatory waves are also present. So probably the patient is having the atrial fibrillation. One more thing, guys, how to calculate the rate in the ECG, how to calculate the rate for those patients who are having the irregular RR interval, who are not having the regular rhythm. So if you guys remember, if you are seeing this ECG series, then I have discussed that how to calculate the rhythm, how to calculate the rate in an ECG paper of some patient, but those rate I have discussed for the regular RR interval, for the regular rhythm, right? But in some case, if the patient is having the atrial fibrillation or having the irregular RR interval, in those cases that formula is not applicable, which I told you, that 1500 divided by number of small boxes, right, in between the RR interval. So that formula is not valid for in those cases who like in these cases where the patient is having the atrial fibrillation. So in these cases what you need to do is that you need to count the here we are actually talking about the 30 large boxes, right? So what we'll be doing is that this is called as the 30-second rule, right? This is called as the 30-second rule. So what do I mean by the 30-second rule? Okay, no confusion, guys. 30-second rule we are using for calculating the heart rate in the patient, right? So we are gonna calculate the heart rate of the patient through the ECG of irregular RR interval or having the irregular rhythm, right? So how to calculate the rate, guys? You just need to count the bigger boxes, right? Bigger 30 boxes, right? So 30 big boxes you need to count. For example, I am taking this ECG, right? So for example, this is the first one, right? Then 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 21 22 23 24 25 26 27 28 29 30, right? So here till here we are having the 30 box or 30 boxes, right? Bigger boxes. Now from first to 30, how many QRS complex we saw? Very simple. So 1 2 3 4 5 6 7 QRS complexes we saw over here, or 7 R waves we saw over here, right? So formula is very simple. The number of QRS complexes in 30 large boxes multiplied by 10. So heart rate will be 10 into QRS complex in 30 big boxes, right? So accordingly over here the heart rate will become 10 into number of QRS complexes become over here, that is the 7. So 10 into 7. So for this patient the heart rate became 70 beats per minute. I hope you got the idea. But that is applicable for the patient I'm sorry, this is applicable for the patient who is having the irregular RR interval or having the irregular rhythm. Okay. So once again guys, the patient is having the almost having the narrow QRS complex, right? And if you will be seeing the the rhythm of this patient or the RR interval over here, right? So second lead, so you will be seeing that having almost around more than 4 bigger boxes, right? More than 4 bigger boxes, right? So that is the thing over here. So right, so how to calculate the heart rate in the patient who is having the irregular RR interval, that is the formula. Okay, fine. Now look at this ECG. In this ECG we are seeing that QRS complex, but having the irregular rhythm. Okay, narrow QRS complex, right? And usually the patient might be having the tachycardia as well, right? So that is the thing over here, right? But having the irregular RR interval is the main criteria for the atrial fibrillation. So this patient is also having the atrial fibrillation, right? Okay, and in between they are having the fibrillatory waves, right? In between they are having the fibrillatory waves, right? These are the fibrillatory waves. Okay, fine. Later you can say that some patient might be having the 3:1 fibrillatory wave or the 4:1 fibrillatory wave, depend on how many fibrillatory waves are there. But for now, for the simplifying purpose, that is the fibrillation, that is the atrial fibrillation mainly, right? Okay. Now from there I am moving on to the atrial flutter guys, right? Now let's move on to the atrial flutter. Okay. In the atrial flutter, what I need to understand or what I need to remember over here is, usually in the atrial flutter also you will be seeing the tachycardia, you might see the tachycardia, right? Right, in most of the cases you will be seeing the tachycardia. So it means the heart rate will be more than 100, right? Even far more than that, right? Exceeding 200 to 50 beats per minute as well. Over here usually, okay, what we are seeing is that the RR interval is regular, right? So usually comparatively, if you will compare the atrial flutter with the fibrillation, usually atrial flutter is having the regular rhythm. These patients are having the regular rhythm as compared to atrial fibrillation. Atrial fibrillation patients are not having the regular rhythm, right? Okay. Second thing over here is that usually atrial fibrillation patient, right, you will be seeing that the patient heart rate, okay, the formula which we are using over there in the atrial fibrillation patient is the count the number of bigger boxes. These are 30 big boxes. Among 30 big boxes, QRS complex you will be counting and multiplying it with the 10, right? I showed you the example as well. Over here in this case, because the rhythm is regular in most of the cases, you will be applying the old formula only, that is the 1500 divided by the heart rate. Okay. But one more case over here, sometimes the heart rate is very quick, that formula might not be satisfied for these kind of cases, right? So that is also the case. Okay guys, so over here if you will be seeing the for example this ECG, right? So this ECG is having the blurriness. I will go skip this ECG. Look at this ECG over here. Okay, so over here what I can see is the QRS complex is not that narrow, so QRS complexes are broad over here only, but in between, right, what I can see is these are the this might be the T wave, but this is the these are the flutter waves. These are the flutter waves over here. So these are also called as the F waves. These are also called as the F waves, or these are also called as the sawtooth pattern. This is also called as the sawtooth pattern, right? So for example, look over here, right? What I can see is this and this, right? So sawtooth pattern over there, right? So basically in the atrial fibrillation, what I can see is you will be seeing the fibrillatory waves, and the interval, RR interval, will be varying. So RR interval, so irregular rhythm you will be seeing over there, irregular RR interval. In the atrial flutter you will be seeing usually the sawtooth pattern, you will be seeing the sawtooth pattern, right? You will be seeing the sawtooth pattern that is usually seeing in the atrial flutter, right? Sometimes it might be difficult to differentiate atrial flutter with the fibrillation, because in the atrial fibrillation we are seeing the fibrillatory waves, in the atrial flutter we are seeing the sawtooth pattern or the flutter waves, right? But basically the rhythm, if it is irregular, then usually it should be atrial fibrillation. If the rhythm is regular, then it is the atrial flutter. Okay, thank you.